So here جميعا. Actually, my talk to you today is going to be about adipocytes in osteoarthritis, whether they are mean or an angel. And before I start, I would just like to tell you that we have in Egypt more than 11.5 million patients who have symptomatic knee pain. Almost 50% are above the age of 65. And those patients make around 4 million visits annually to both rheumatologists and orthopedic surgeons. And 1/4 undergo surgery every year. Unfortunately, 40% of those patients are not satisfied with the treatments, and more than 50% have difficulty to perform normal prayers. Actually, the beginning for this, my presentation, started more than 10 years ago when I was investigating bone marrow lesions in osteoarthritis of the knees, and I was correlating them to high sensitive CRP. And I started to find that that BMLs could be present anywhere in the knee, medially, laterally, in ossified chondromatosis, and even centrally around the attachment of the anterior cruciate ligament. And so I made my first publication around this matter. And afterwards, I started to take a biopsy from the bone marrow lesions from patients undergoing joint replacement. And I found something very strange, and the pathologist and myself, we had very long conversations on why there is such a big adipocytes present in the bone marrow lesions, together, of course, with infiltration of lymphocytes and macrophages. I started to ask myself, from where do these adipocytes come from? Well, they come from the stem cells, the bone marrow stem cells, which differentiates to adipocytes and osteoblasts. And the function of these adipocytes depends on the location. In females, usually, the fat is present in a pear shape, while in males, the obesity is usually truncal. We have two different types of adipocytes. We have the brown or beige adipocyte, and these are very active metabolically. They have a lot of mitochondria and a very powerful respiratory chain. They have very important actions. And in the newly born baby, if the baby starts to shiver after being delivered, they start to produce heat immediately in order to save the life of this baby. While the white adipocytes, they are disastrous. They don't do anything except harboring fat, a very fat globule inside them, and metabolically they are not active. They're just, they work as a depot of fat. And what is important is that macrophages usually intermingles with these fat adipocytes. And so it seems that they interact together. And when they interact together, when the adipocytes start to swell, it seems that they attract the macrophages, and macrophages start to differentiate into M-type, M1 type macrophage, which is very bad and produces a lot of inflammatory mediators. The scenario ends with a lot of fibrosis, a lot of inflammation, a lot of M1 type macrophages, and dead adipocytes. Now, what does the visceral fat do to us? First, it is a site for conversion of local macrophages to pro-inflammatory M1 phenotype. Second, it suppresses adiponectin, which is an anti-inflammatory cytokine found to have articular effects. And third, they produce leptin, which has deleterious effects on chondrocyte metabolism and increases with visceral fat accumulation. And as you can see here that the more visceral, the percentage of visceral fat the patients have, the more the sensation of pain in the knees. And also in an important trial in mice, where the mice, some of them were given a conventional diet, and the others were given high carbohydrate, high fat diets. And then they were sacrificed, and we had the chance to look into the synovium. And those fat mice had thickened, disorganized synovium with macrophage infiltration. So the question, how does obesity impact osteoarthritis? Well, it does through the diet, the weight, the inflammation, and gut dysbiosis. And this is an old slide that I have showing that with mechanical loading, we have stimulation of 5-alpha-beta-1 integrin CD47, which leads to intracellular signaling together with a calcium influx, and they lead to gene expression and the production a lot of cytokines, mainly interleukin-1. What is also very important to mention regarding obesity is that patients who have metabolic syndrome, the more they have components for metabolic syndrome, the more they have a cumulative incidence and progression of osteoarthritis. And as you can see, that women are suffering as a cumulative incidence more than men when they have the metabolic syndrome. And also the progression of osteoarthritis is much more in women, but also present in men if they have a lot more components of metabolic syndrome. It's very important to mention also that the obese colonic flora is distinct from the lean colonic flora, with the increase in pro-inflammatory macrophages. And what is really exciting is that macrophages inside the joint have been shown to come not only from the bone marrow, but they come from the gut. Now, how is this? This is very strange. We know that there is something that called the leaky gut syndrome, which occurs in the obese diabetic microbiota. Now, what happens in this leaky gut syndrome is that there starts to appear some gaps between the columnar cells resting on the basement membrane of the intestine, and then undigested food particles, which of course are going to make some reactions when they go into the circulation. Toxins and bacteria, they pass from the intestine directly to the bloodstream. But this is not all. Macrophages also will pass from the gut into the circulation, and then they go and they lodge themselves inside the joints. Many will ask, what is the effects of the bariatric surgeries for weight loss on the knee pain in patients with OA of the knee? Now, this is very important, and there are lots and lots and lots of trials. I've just selected to you one to show you that there is definitely a decrease in pain after 6 months and after 1 year, decrease in joint stiffness after 6 months and after 1 year, and physical function also in patients who had this operation using the WOMAC score. So definitely the patients undergoing this kind of surgery will have dramatic improvement starting from the first month after the surgery. Now, as long as we want to treat our patients, and we are trying to look all the time for medications for osteoarthritis that relates to adipocytes, which is, of course, the topic of my talk. Well, I just need to remind you, do you remember adenosine triphosphate? Because extracellular adenosine activates brown or beige adipocytes through the A2A receptor, and they enhance thermogenesis, lipolysis. They regulate inflammation and immune responses. Now, we all use clopidogrel sometimes as an antiplatelet agent used to treat patients with coronary artery disease. We also start the newer version, which is the ticagrelor. They both work by antagonizing the binding of adenosine diphosphate to P2Y receptor on platelets. Thereby, they reduce the platelet aggregation. Now, what is the surprise? That there was a reduction in the osteoarthritis risk after treatment with ticagrelor compared to clopidogrel. And ticagrelor appeared to reduce the risk of all osteoarthritis subtypes by 29%, with significant reductions in hand and knee osteoarthritis. And this action is mediated through increasing the extracellular adenosine. And because of this paper has been published only only 4 months ago, I'm expecting that next year we will find many papers addressing the action of ticagrelor on OA. Another important issue, which is oligofructose, because oligofructose mitigates the systemic and synovial inflammation in obese mice. It appears that it boosts feeling of fullness, it reduces hunger, and it gives a lower calorie intake. And if you go when you are in USA and you go to the pharmacist that sells, all the nutrients, you will find a lot of oligofructose in big jars if you need to take it. But you don't need to have to do this because oligofructose is present in abundance in fruits and in vegetables. So if you want to ease the pain in your knees, give yourself some more veggies and fruits. To summarize my talk to you, adipocytes are increased in number and volume in osteoarthritis patients. Macrophages play a dramatic role in activating adipocytes. The metabolic syndrome components are related to the incidence and progression of osteoarthritis. Mice fed on high carbohydrate, high fat diet had an inflamed, thickened, and fibrosed synovium. The obese colonic flora is distinct from the lean flora with increased pro-macrophages. Oligofructose mitigates synovial inflammation in mice. And finally, ticagrelor, an antiplatelet agent, may reduce the risk of osteoarthritis. Ladies and gentlemen, I hope you have enjoyed my brief talk on the osteoarthritis of the knees, and thank you very much.